So I just want to tell you a little bit about my journey related to my core. About a year and a half ago, I had a ruptured appendix, and then I was back in the hospital with sepsis, and I developed scar tissue, a lot of tension in my abdomen. Recovered from that. I was exercising and doing more, but I did have a limitation on how much I could run and hike. Definitely had some pain on that side, and it felt like there was some weakness. Well, at Cornerstone, we were doing some teaching on core ultrasound as a group, and I was the guinea pig because I just had abdominal surgery. Well, what happened was I had no core activation, involuntary, but I couldn't activate my core while thinking about it. And I was like, to save my life, I was clenching, trying to fire these muscles, nothing was happening. So as I was helping a friend out doing some core training with ultrasound, I decided to put it on myself and do some training activities. Most of the exercise I did not activate my core, but the one thing that did was going through a movement that's similar to walking. It was basically pelvic engagement elevation. When I started working with the ultrasound and I could see it and see it in real time, see my muscles engage and find out what caused them to engage, it was almost like something turned on in my brain. I was able to engage. Later on, we did another ultrasound training. This is months after the fact. I could, to my surprise, actively engage my core without realizing that it had been working. Now, I still have a ways to go. I have further training to do, and I'm going to be part of the core training program that Cornerstone has put on to continue to do things that I love, to hike, to be able to not have those limits of pain and tension when it comes to hiking and being outdoors in this beautiful place.